Hello and welcome to another episode of Discover with Spinati. I'm your host, Dr. Spinati, with a very raspy voice because I did some training this weekend and I was yelling a lot during training. So this here, we're talking about veneers, and Charlie is going to help me in demonstrating what veneers are, and we're going to talk about why veneers are bad. So this here is a veneer. This here is a veneer right here, and you can see how thin it is. I'm going to put it right there. I'm going to twist it around so you can see it. See how thin it is? Super, super thin. You can see here Charlie has irregular teeth, and he has long teeth and space between his teeth. What this veneer does, if placed properly, as you can see, it actually closes that gap. So if you can imagine two of them side by side, it'll actually close that gap. You can see it right there. Close the gap. So see before and then after. You see that? So two of them will close the gap, and it actually will make it look a lot nicer. As you can see here, his teeth don't look very nice, whereas this veneer looks beautiful. See that? And that is the point for today's topic, is to discuss why veneers are bad. Because a lot of people think, or not a lot of people, some people think that veneers are bad. And I'm here to discuss why they are. Thank you, Charlie. I appreciate your help. Thank you. What are veneers? Well, first of all, I'm going to tell you what they're not. Okay? Veneers are not the cure to your teeth. So they will not replace good oral hygiene. So just because you have veneers doesn't mean that you're not going to be able to, or that you don't have to brush and floss anymore. No, that's not the case. It's actually the opposite. If you have veneers, you have to be more diligent in brushing and flossing, because now you have porcelain and you have a margin, okay, between the tooth and this veneer that bacteria can get trapped in. But if you maintain them properly, they can last you a very, very, very long time. What they're also not is that they're not there to prevent cavities, right? Because people think, well, I mean, it's porcelain. How can porcelain get cavities? You're right, it can't. But beneath the porcelain, you can get cavities. So it's not a replacement for you to think about, oh, now I can never brush again. And certainly they're not there to prevent gum disease. Gum disease is simply an inflammation of your gum tissue because of accumulation of bacteria in the form of plaque. Now, veneers, what are they? Veneers, as I discussed with you, they are a cosmetic enhancement. Okay, so you have veneer here. Okay, you have Charlie, and you've got a cosmetic enhancement of Charlie. See how Charlie's nice and colored, right? He's got nice makeup on and everything, but his teeth aren't really that great. So with this veneer permanently on, now he's going to look great all the time, especially with all his multicolored face. Okay. We don't judge, Charlie. You can have a multicolored face. Still love you. Right. So what veneers do is that they fix certain things about your teeth, about your smile. I'm going to go through them. They fix discolored teeth. So if your teeth are discolored, so I see a lot of people. Charlie, thank you so much. He's such good help today. There are a lot of people that have, like, for instance, this tooth would be discolored. This tooth would be a little bit different color than this one, or this one would be different color than that. So veneers, they allow you to have the same color throughout all your teeth, and that's why people with veneers look like they whiten their teeth all the time, right? That's why it looks freaking fantastic. Some people, now Charlie here has uniform teeth. What uniform teeth I mean is, this tooth looks exactly the same as this one. This one looks like this one. This one looks like that one, so on and so forth. But the majority of people don't. The majority of people don't have that. Majority of people don't have uniform teeth. Some people have, these two are incredibly big. These are small. Lateral teeth are small. These ones are either very short because of the grinding. Like, there's a lot of non-uniformity. Okay, so veneers definitely fix that. Okay, so they fix that, and they allow you to have that beautiful smile. And they actually, if your wear isn't very severe, they can actually allow you to regain that original appearance of your teeth, which makes your face look a lot younger. And that's another aspect of veneers, is that actually adds back around 10, 15 years to to your face. It actually does, without any other cosmetic procedures, without doing any facelift, without doing Botox, without doing any fillers, nothing. Just by doing veneers, you will look younger. Now you're going to ask, how is that possible, Dr. Spinati? Well, I'll tell you why. It's actually very simple. When you're as we get older, our teeth naturally get shorter, right? Because naturally speaking, whether you're a severe grinder or a mild grinder or not a grinder at all, your teeth naturally wear off over time. And so, the older that we get, the less tooth structure that we show. And studies have shown that the youth show more teeth, okay, when at their rest. So when they're like this, not smiling, right? They show more teeth than people that are older. And the amount is around 1 to 1.5 millimeters, all right, beyond the lower edge of the lip. Well, if you're older and now all of a sudden, now you have teeth that are, showing 1 millimeter beyond your tooth, now you're going to look younger just without even smiling, right? I'm not even talking about the effect of smiling and the effect of, getting rid of all the bad appearances of your teeth, allowing your gum tissue to actually heal properly around your teeth if your teeth have been worn, or if they have excessive amount of fillings, or they've been, hacked away from a lot of toothbrushing or whatever it is. I'm not even talking about that. I'm talking simply from regaining the length. You can actually regain your youthful appearance. It's that magical. And the reason it works is because our human eye has been trained, because of our, what we see and how we grew up, has been trained to notice these things. And this is backed up by studies, a lot of them, where people evaluate different types of smiles and teeth and faces and whatever. And they found that that's the reason why a lot of people appear youthful, is because their teeth are showing more than, their older counterparts, their older colleagues. So that's another reason why people get veneers. If you have small teeth, right? If you're naturally born with small teeth, right? A lot of people are. So and even younger people, there are a lot of young people that have small teeth and they look old because they have small teeth. So this will restore their youthful appearance. And I say this with a caveat: if you have very mild crowding, then veneers can help straighten your teeth. But I'm saying very mild crowding. The reason I say very mild crowding is because if you have crowding, okay, let me see if Charlie can help me with this one. If you have crowding where your teeth, like, let me see here. So see how Charlie here doesn't have any crowding, his teeth are nice and straight. So if I were to place a veneer here, right, it's basically just putting it on top, right? Remove a little bit of tooth structure, put it on top. But if his teeth are crowded, so let's say this one is out a bit, right, and twisted. Well, in order for me to make this straight, I'm gonna have to hack away a lot of that tooth structure. If this tooth here is out and twisted, I'm gonna have to hack away a lot of that tooth structure in order for it to actually become straight. Well, if I do that to multiple teeth, you can imagine the insane amount of sensitivity and potential damage to nerves. And I see this all the time, especially from people that go overseas, whether it's Turkey, whether it's India, whether it's Lebanon, whether it's Mexico, wherever they go, okay, because these people that they go to, obviously they're trying to make a quick buck and they're trying to, get the procedure done. Obviously, they want to make money too. They don't want to waste time. And so, if they see these things, they're going to say, yeah, of course we can do it. They're not going to put you through orthodontics, obviously, because orthodontics takes time. But the best thing for you to do if you have very crowded teeth is for you to actually get orthodontics, right? For you to go into Invisalign. Because Invisalign, what it does is it straightens your teeth and corrects your bite. And what that does is that allows you to have veneers. I had many patients come from overseas, that have chipped porcelain, okay, chipped. And then you look at their bite's way off, okay? And to me, I'm like, well, there's a reason why it's chipping. And the reason why it's chipping is because your bite's off. So obviously, whoever did it wasn't really concerned about your bite, was really more concerned about their pocket. And I don't know that dentist. So I mean, I can just say it generally speaking, because the proper way to treat someone is to look at the longevity of that treatment. It's not enough for you just to treat someone right away and then kind of cross your fingers, close your eyes, and hope that things are going to work out. That's irresponsible kind of treatment. The proper way of doing it is to actually straighten the teeth, correct the bite, and then do cosmetic enhancement, because then the cosmetic enhancement will last 10, 15, 20, 25 years, okay, or even longer if it's done properly. And I said this before, veneers, once they're bonded on, if they're bonded on properly, I'm telling you right now, they're impossible to remove. Like, impossible to remove. Um, they're harder to cut off than your enamel, right? I mean, I've had that experience where I had to cut off veneers. I'm telling you, it takes a long time and a lot of skill in order for that veneer to be removed without damaging the underlying tooth structure. It's tough. It's not easy. So once this stuff is bonded on, it's on, right? So if you have proper bite and the veneers are bonded on properly, that stuff will last you. Like, I don't see why it wouldn't last you a lifetime. But the only reason why people replace them after around 15, 20 years is because then the gums start to recede a little bit. I mean, that's what happens when you get older. The gums start to recede a little bit, and then you start seeing that margin of the veneer, and it doesn't look as nice as when you first got in. So that's why people get it. People get it redone. Now, why not get veneers? Because here it says, why are veneers bad? Why not get veneers? Why you shouldn't get veneers is if you have gum disease. So if Charlie here doesn't have any gums, okay? But if Charlie had gums and his gums were inflamed and red and bleeding, then I wouldn't put veneers on Charlie, right? I would wait. I would coach Charlie until we get Charlie to a stable condition with his gums, and then I'd put veneers on. Otherwise, I wouldn't put veneers on, because when you put veneers on, porcelain will definitely make it worse, okay? Especially if there's any kind of ledging, right? If it's not smooth with the tooth. I mean, a lot of these things, there's a lot of factors that comes into play when it comes to proper veneer placement. Also, when not to get veneers. When veneers are bad is when you have severe crowding, or when you have crowding at all, or when your bite's not right. A lot of people come to me for consultations for veneers, and they come and they say, I want veneers. And I say, okay. And then I look at their teeth and I analyze their bite. I said, I can't put veneers on your teeth. And they say, why? I'm like, well, because you have a bad bite. Your teeth are crowded. If I put anything on there, they're going to chip. And then you're going to come to me and you're going to be dissatisfied. And I charge a lot of money for veneers. Because, as you can see, like, it takes a lot of time, it takes a lot of skill, a lot of communication with the lab. And I guarantee my veneers for 5 years. So if anything happens within 5 years, I fix them, no charge. So, I mean, I have to make sure that they're actually going to last you, right? I mean, I stand behind my work. So, if you have severe crowding, I'm not putting veneers on, because I know they're not going to last. If they're, if you're going to come back and you have sensitivity, or you're going to come back and it's chipping and whatever, that's on me, right? So I'm not going to do that. And you're not going to be happy, because obviously you've spent all this money and now you have to come back and see me so often. You're not going to be happy about it. So if you have severe crowding or improper bite, veneers are not for you. You have to straighten your teeth first. I mean, there's no two ways around it. You have to straighten your teeth. If anyone tells you otherwise, they're lying to you, or they just don't know what the heck they're talking about. Or if you have very large fillings. If you have very large fillings, veneers are not the right option for you, right? At that point, you have to consider doing crowns. And crowns look just as beautiful as veneers do. They hug the tooth a lot, circumferentially 360 degrees, as opposed to just the surface. So that's why veneers are bad, people. That's why veneers are bad, okay? And in reality, veneers aren't bad. Veneers are actually a very good cosmetic enhancement. They are better than Botox, better than fillers, better than facelifts, better than any other cosmetic procedure, better than wearing a suit, right? You can wear just a shirt. As long as you have very nice teeth, man, you will look incredible. Same thing with like putting makeup on, or like wearing a beautiful dress for women. I'm telling you right now, if you have beautiful teeth, you'll be surprised as to how much less you have to enhance yourself cosmetically when you have amazing smiles. You'll be surprised. Okay. Ask people that have had veneers, that have really nice veneers. Ask them and ask them about, what they think about their veneers, what they think about their cosmetic enhancements. Ask them. I highly suggest you do. Anyways, this has been fun. As you know, I'm very passionate about veneers. I'm very passionate about cosmetic enhancements. I'm very passionate about dentistry in general. I'm passionate about dental implants and whatnot. So if you have any questions, feel free to feed them to me. I'm more than happy to answer them for you. And as always, keep smiling.